Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Monkeypox. Introduction. Monkeypox is a rare viral disease. It is similar to smallpox, but usually milder. Monkeypox is rarely fatal. Before 2022, most cases of monkeypox have happened in Western Africa. In 2022, an outbreak of monkeypox spread across several countries that don't normally report monkeypox. This program discusses the symptoms and causes of monkeypox and how to prevent the infection. Monkeypox virus. The monkeypox virus causes a rare disease called monkeypox. The virus is found mainly in Central and Western Africa, but has also been reported in other countries. The virus is called monkeypox because it was first found in 1958 in laboratory monkeys. Since then, the virus has been found in other animals. Squirrels, rats, mice, and rabbits may be carriers of the virus. Monkeypox was first reported in humans in 1970. A person infected with the virus can spread it to other people. An infection with the monkeypox virus may cause fever, headache, muscle aches, and other health problems. Monkeypox is similar to another virus known as smallpox. Smallpox is a serious, contagious, and sometimes fatal disease. Symptoms. In people, the signs and symptoms of monkeypox are like those of smallpox but usually milder. Unlike smallpox, monkeypox causes the lymph nodes to swell. Monkeypox is not considered as dangerous as smallpox. The symptoms of monkeypox include fever, headache, muscle aches, backache, fatigue. Monkeypox also causes the lymph nodes to swell and become tender or painful. Lymph nodes are found throughout the body. They remove cell waste and help the body fight off infection. The monkeypox symptoms usually appear about 12 days after a person is infected with the virus. These first symptoms are similar to the flu and include sore throat, nasal congestion, and cough. A person with monkeypox will get a rash that may be painful or itchy. This rash develops into raised bumps filled with fluid. The rash may be located on or near the genitals or anus, but can also be on other areas like the hands, feet, chest, face, or mouth. The bumps go through several stages before they get crusty, scab over, and fall off. The illness usually lasts for 2 to 4 weeks. Monkeypox symptoms usually start within 3 weeks of exposure to the virus. If someone has flu-like symptoms, they will usually develop a rash 1 to 4 days later. Monkeypox can be spread from when symptoms start until the rash has healed, all scabs have fallen off, and a fresh layer of skin is formed. People infected with monkeypox may experience different symptoms. Some may have only a few symptoms. Most people will get a rash. Some develop a rash first, followed by other symptoms. Others develop a rash before other symptoms, and some only experience a rash. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. The monkeypox virus can be found in monkeys, squirrels, rats, mice, prairie dogs, and rabbits. People can get monkeypox from an infected animal. A person can become infected with the virus through a bite or direct contact with the infected animal's blood, bodily fluids, or rash. Before the monkeypox outbreak of 2022, most human infections were in Africa and from the handling of infected monkeys, Gambian rats, or squirrels. Currently, most infections spread from person to person. An infected person can spread the monkeypox infection to other people by coughing or sneezing. People can also catch the virus by touching the skin lesions of an infected person. Contaminated objects can spread the infection among humans. Objects can become contaminated with the virus through bodily fluids or contact with skin lesions. Examples of contaminated objects include an infected person's bedding or clothing. Coming into contact with an infected person's blood may also result in a monkeypox infection. A pregnant woman can pass the infection on to her unborn child through the placenta. This is known as congenital monkeypox. Diagnosis. Your healthcare provider will first ask about your medical history and symptoms. Your healthcare provider will also perform a physical exam. If you have a rash, your healthcare provider will examine it at this time. They will also check for swollen lymph nodes. Monkeypox shares symptoms with other health problems, including smallpox, chickenpox, measles, and bacterial skin infections. For this reason, a healthcare provider may perform specific tests to determine the cause of your symptoms. Monkeypox can only be diagnosed in a laboratory using one or more tests. These tests can determine if monkeypox is the cause of your symptoms or if there is another cause. Samples of fluid from a skin lesion may be taken for testing. A blood test or throat swab may also be done.
Treatment. Most people with monkeypox recover fully within 2 to 4 weeks without the need for medical treatment. Monkeypox and smallpox viruses are genetically similar, which means that antiviral drugs and vaccines developed to protect against smallpox may be used to prevent and treat monkeypox virus infections. Antivirals such as tecovirimat, TPOXX, may be recommended for people who are more likely to get severely ill, like patients with weakened immune systems. If you have symptoms of monkeypox, you should talk to your healthcare provider, even if you don't think you had contact with someone who has monkeypox.
Prevention. To prevent monkeypox, avoid close skin-to-skin contact with people with a rash that looks like monkeypox. Also, avoid contact with objects used by infected people. Wash your hands with soap and water for 20 seconds, or use an alcohol-based hand sanitizer, especially before eating or touching your face and after you use the bathroom. A smallpox vaccine is available and effective at protecting people against monkeypox when given before they are exposed to monkeypox. Experts believe that vaccination after exposure to monkeypox may help prevent the disease or make it less severe, thus treating it. Vaccination is recommended for people who have been exposed to monkeypox and people who may be more likely to get monkeypox, such as people investigating or treating monkeypox cases. Monkeypox in animals. Infected animals can spread monkeypox virus to people, and it is possible that people who are infected can spread monkeypox virus to animals through close contact, including petting, cuddling, hugging, kissing, licking, sharing sleeping areas, and sharing food. People with monkeypox should avoid contact with animals, including pets, domestic animals, and wildlife to prevent spreading the virus. The signs of monkeypox in animals include bumpy or blister-like rash, cough, discharge from the eyes, enlarged lymph nodes, fever. Pets that have monkeypox also may appear to be very tired and may not be eating or drinking. Animals may only have minimal signs of illness. Some animals have died due to infection, and others have recovered. The smallpox vaccination recommended to prevent monkeypox in humans is not useful for animals. This vaccination is not recommended for pets. If your pet could have been exposed to a sick animal and is showing the symptoms of monkeypox, follow these instructions. Separate the animal from people and other animals immediately. Put it in a room, cage, or cardboard box apart from others, such as in the garage. Wash your hands well with soap and hot water after contact with the animal and any object that may be contaminated with the virus. Clothing should be changed after feeding or caring for the animal. Laundry may be washed in a standard washing machine with hot water and detergent. Using chlorine bleach with white clothes during hot water washing can provide an added safety measure. Use care when handling soiled laundry to avoid direct contact with contaminated material. Soiled laundry should not be shaken or moved around a lot. Infectious particles could be breathed in. Inform your state or local health department that you think you have a pet with monkeypox. The health department may pick up the animal, or they may tell you to take the animal to a vet. Do not release your pet into the wild. If infected, the disease could spread to other animals and people. Do not leave your pet at a shelter. Again, this could spread the disease. Do not take your pet to a vet without calling first. The vet must take precautions to receive your pet. Animals diagnosed with monkeypox, including pets, may need to be humanely euthanized to prevent the spread of this dangerous virus. This is a difficult decision, but it is best for the safety of family, friends, and community. If monkeypox were to establish itself, many animals and people could become ill.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Monkeypox virus causes a disease called monkeypox. An infection with the monkeypox virus may cause fever, headache, muscle aches, swollen lymph nodes, and other health problems. If left untreated, it may cause death. 1 to 3 days or longer after the fever starts, a person with monkeypox will get a rash. This rash develops into raised bumps filled with fluid. The bumps go through several stages before they get crusty, scab over, and fall off. The illness may last 2 to 4 weeks. An infected person can spread the monkeypox infection to other people by coughing or sneezing. People can also catch the virus by touching the skin lesions of an infected person. Monkeypox can only be diagnosed in a laboratory. 1 or more tests can determine if monkeypox is the cause of your symptoms or if there is another cause. Samples of fluid from a skin lesion may be taken for testing. A blood test or throat swab may also be done. Vaccination against smallpox is effective in preventing monkeypox. Vaccination is recommended for people who have been exposed to monkeypox and people who may be more likely to get monkeypox, such as people investigating or treating monkeypox cases. Infected animals can spread monkeypox virus to people, and it is possible that people who are infected can spread monkeypox virus to animals. Thank you for using Explain.